Welcome. The following is a presentation given by the Office of the Medicaid Inspector General to provide a comprehensive and detailed review of the retroactive disenrollment process. Thank you for participating. Please note at the end of this webinar, contact information is provided should you have any questions. The retroactive disenrollment process recovers capitation payments for individuals who are no longer eligible for Medicaid managed care. The local districts play an important role in identifying individuals who should be retroactively disenrolled and submitting the appropriate notifications to OMIG and the plans. Table of Contents. Overview of retroactive disenrollment, slides 3 through 9. This provides a brief overview of the retroactive disenrollment process. Submission of retroactive disenrollment notifications, slides 10 through 20. This describes the process for submitting retroactive disenrollment notifications. Electronic retroactive disenrollment notification form, slides 21 through 24. This provides a brief overview of the electronic form. Electronic form, entering the data, slides 25 through 38. This goes over entering data into the electronic form in detail. Retroactive Disenrollment Codes, slides 39 through 42. This lists each of the retroactive disenrollment codes. Disputed column and dispute process, slides 43 through 51. Reviews the process for plan disputes of retroactive disenrollment notifications. Revision process, slides 52 through 59. Describes the process to revise or correct a retroactive disenrollment notification. Common errors, slides 60 through 63. Goes over errors commonly made in submitting retroactive disenrollment notifications. Final reminders, slides 64 through 73. A few final reminders related to this process. Third-party health insurance and Medicare, slides 74 through 76. This describes the role of third-party health insurance and Medicare as it relates to retroactive disenrollment. Contact information, slides 77 and 78. How to get in touch with individuals at OMIG to assist you with any questions you might have about this process. First, we will provide a general overview of the retroactive disenrollment process. Retroactive disenrollment occurs when an enrollee's membership in a Medicaid managed care plan terminates. Some membership terminations result in a prospective disenrollment. However, there are specific circumstances in which retroactive disenrollment is allowed. The Medicaid Managed Care Family Health Plus Special Needs Plan Model Contract identifies specific instances for which an enrollee's membership may be terminated retroactively. Section 8 and Appendix H of the Model Contract has detailed information on disenrollment. This process can also be used for managed long-term care retroactive disenrollments. The local departments of social services, LDSS or local districts, New York State of Health, and New York City's Human Resources Administration, or HRA, are responsible for notifying the plans and OMIG of the enrollee's retroactive termination and the effective date of the termination. The effective date of the termination is the date the event took place, not the date the local district is notified of the event. For example, a Medicaid recipient may be incarcerated on March 27, 2015, with local district notification of the incarceration on June 3, 2015. The effective date of termination is March 27th, not June 3rd. Since the plan was at risk from March 1st through March 26th, the plan is allowed to keep the March capitation payment. Capitation payments to the plan may be recovered from April 1st, 2015 through the last full month of incarceration. The plan is notified of the enrollee's membership termination via an electronic retroactive disenrollment notification, or electronic form. On April 1, 2014, the paper retroactive disenrollment notification form was replaced by an electronic form, and the quarterly report to the plans was discontinued. In addition, OMIG assumed management of the retroactive disenrollment database. When an enrollee's membership in the plan is terminated, the plan often continues to receive capitation payments. Please note that the local district is responsible for notifying the plans of all retroactive disenrollments. Notifying OMIG will not result in the plan being notified. The district must securely transmit the notifications to the plans and OMIG. The plan has 30 business days from receipt of the retroactive disenrollment notification to void the capitation payments received after the enrollee's termination. Upon receipt of a retroactive disenrollment notification, the plan has 10 days to submit their dispute to the local district, Department of Health, or New York State of Health. OMIG conducts retroactive disenrollment audits to recover capitation payments the plan has failed to void within 30 business days. Examples of circumstances leading to retroactive disenrollment: if a Medicaid recipient becomes a permanent resident in a skilled nursing facility or is admitted to a state psychiatric hospital or residential institution. A Medicaid recipient enters foster care. A Medicaid recipient is also covered by commercial health insurance offered by the same plan in which the recipient receives Medicaid coverage. If a Medicaid recipient has been enrolled in a plan without his or her consent or knowledge. If a Medicaid recipient has a break in managed care coverage. If a Medicaid recipient is receiving benefits in another state. The federal government provides data to all the states identifying individuals who are receiving benefits in another state. The report is entitled the PARIS Match. PARIS stands for the Public Assistance Reporting Information System. Another example, if a Medicaid recipient has died. This section covers the current process for submission of retroactive disenrollment notifications. First, submissions by local districts. All submissions of retroactive disenrollment notifications or submissions are transmitted electronically using a formatted Excel spreadsheet or electronic form. The electronic forms contain protected personal information and/or personal health information and must be submitted in a secure transmission. It is important to remember that a secure method must be used anytime the electronic form is transmitted. The method of secure transmission used by the majority of the local districts, HRA, and New York State of Health to submit electronic forms to OMIG is an application on the New York State Department of Health Health Commerce System, or HCS, website. The HCS application is entitled NYS LDSS and NYSOH Retro Upload, or Upload, and is pre-filled to transmit submissions to OMIG Retro Data SMB. Detailed instructions have been emailed to all the local districts, HRA, and New York State of Health. If you need additional help, you may send your questions to retrodata@omig.ny.gov. This mailbox will be used for questions. On the same day the submission is transmitted to the plan, the retroactive disenrollment notification must be transmitted to OMIG. It is very important that the submissions to the plan and OMIG are made on the same day. The date on the electronic form starts the clock for the plan to void capitation payments or dispute the submission. The plans have 30 business days to void the payments. The transmission of the electronic form to the plan must also be a secure transmission. The HCS upload application cannot be used to transmit electronic forms to the plans. Please remember, the transmission of the electronic form to and from the plans must be secure. Submissions for Medicaid recipients enrolled by New York State of Health. Submissions to New York State of Health are somewhat different, and the following slides will define the procedure. The local districts and HRA submit the retroactive disenrollment notification to their Department of Health Local District Support Liaison. The liaison evaluates the retroactive disenrollment notification and takes the appropriate actions, including transmission to New York State of Health. Local districts and HRA should not submit retroactive disenrollment notifications directly to New York State of Health. Questions related to the previous slide may be submitted to edithwalbert@health.ny.gov. For Medicaid recipients participating in residential rehabilitation services for youth, admission and discharge notices may be submitted to hxexclusions@health.ny.gov. You can also call 518-473-6397. For specific retroactive disenrollment circumstances, there are mailboxes provided to receive the information. The RRSY program is designed specifically to serve chemically dependent individuals under the age of 21. Adolescents admitted to RRSY facilities are not eligible for enrollment in Medicaid managed care. Providers are paid fee-for-service. For Medicaid recipients in need of permanent placement in a skilled nursing home, an intermediate care facility, a congregate care facility, a special needs plan, or a managed long-term care program, the notices may be submitted to hxfacility@health.ny.gov. Questions on items 4 and 5 may be referred to the Bureau of Medicaid Enrollment and Exchange Integration, Office of Health Insurance Programs at 518-473-6397. The following slides illustrate data entry on the electronic form in detail. The electronic retroactive disenrollment notification form, or electronic form, is an Excel spreadsheet. If you are not familiar with Excel, try to locate a colleague who may be able to provide assistance. The design of the electronic form was based on the paper retroactive disenrollment notification form used prior to April 1, 2014. The cells and fields in the electronic form have been pre-formatted. Since the electronic form has been pre-formatted, all you have to do is enter the data. Each column is labeled and identifies the data to enter. Each row of the electronic form is an individual retroactive disenrollment notification record or record for a Medicaid recipient. Not all columns require data entry for each record. Only one plan's data may be entered on each electronic form. It's important to remember, on the same day the district submits a file to OMIG, the file should also be securely transmitted to the plan. Please note that the upload application does not submit the file to the plan. Once the electronic form template is opened, you should perform a Save As and rename the template with the name of the electronic form. This should be done prior to entering any retroactive disenrollment data in order to prevent the original template from being corrupted. The template may be corrupted if the data is cut and pasted from another source or the user reformats a cell or field. If the template is corrupted, the retroactive disenrollments will be rejected and will not enter the database. If the template is corrupted, request a new template from OMIG by sending an email to retrodata@omig.ny.gov. The following slides will explain in detail each entry on the electronic form. The naming methodology for the electronic form is as follows. The form name is always 16 digits. The first two numbers are the two-digit county code. Clinton County's code would be 09. Be sure to include leading zeros on the county code. The next 8 numbers are the plan's Medicaid provider number. For example, Good Care Health Plan's Medicaid provider number would be 01238765. Remember to include leading zeros for the plan's Medicaid provider number. The last 6 numbers are the date in the format month, day, year. For example, 032717. Do not enter the date as 03/27/17 or 03-27-17. The correct electronic form name for the example provided on the previous slide is the following: 0901238765032717. Remember to include leading zeros for the county code and provider Medicaid number. Now we're going to spend a few minutes walking through the specifics of the form. For the purposes of this presentation, we've highlighted in green the fields as we discuss them. Row 1 of the electronic retroactive disenrollment notification has the column headings. The first retroactive disenrollment notification, or record, is entered on row 2 in the cell highlighted in green. The first record is assigned the number 1, even though it is on row 2 of the electronic form. Each record must be assigned a number using the format 1, 2, 3, and so on. Leading zeros are not used for the line numbers. The line numbers must be consecutive, and do not number a line and leave it blank. All numbered lines must have a record. Enter your two-digit county code in the cell highlighted in green under the column County Code. All county codes must be 2 digits. For example, Albany County's code would be entered as 01. Be sure to enter the leading zero. If a county code is not entered, the record will be rejected and will not enter the database. Enter the provider's Medicaid provider number in the cell highlighted in green under the column entitled Plan ID. Be sure to include leading zeros, and remember, the plan ID is always 8 digits. The SIN is the client identification number. The SIN is entered in the cell highlighted in green in the column entitled SIN to be voided. The SIN is always 8 characters, 2 alpha, 5 numeric, and then 1 alpha. The SIN to be voided is the SIN for which capitation payments will be recovered. The plan should void the claim within 30 business days. Always double-check to make sure the correct SIN is entered. A common error is to transpose the numbers in entering the SIN. If an invalid or incomplete SIN is entered, the record will be rejected and will not be entered in the database. Note that the last name field is listed first on the form. Be careful to fill out the name fields correctly. Make sure the last name is spelled correctly, and be mindful that last names may be hyphenated, such as Lopez Garcia, or may have junior, senior, etc. Enter the appropriate disenrollment code in the Disenrollment Code column. Do not enter code descriptions in this column. Disenrollment codes are always 2 digits, 01, 07, 09. Be sure to include leading zeros. Please note that Code 11 is no longer a valid code and should not be used. Enter the start date of the disenrollment in the Repay Premium From column. This will be the first month that capitation payments will be recovered from the plan. Enter the month which includes the disenrollment end date in the Repay Premium To column. Always enter as the first day of the month. Dates should be entered using a slash between month, day, and year. The electronic form will automatically format the date to the correct date format. Please do not reformat any of the date fields. The day entered is always the first day of the month. If the repayment is for 1 month, such as March 2015, enter 03/01/15 in the Repay Premium From column, and then the same day in the Repay Premium To column. If there is a break in the repayment period, each interval must be entered on a separate line. The above entry illustrates that Mr. Temple had 3 separate intervals when he was covered by commercial health insurance. Note that the data associated with each date interval is re-entered on each line. The dupe SIN to be retained column is used with Disenrollment Codes 06 or 13. Disenrollment Code 06 is for a recipient with duplicate SINs and the recipient is enrolled in one managed care plan. Disenrollment Code 13 is for a recipient with duplicate SINs and the recipient is enrolled in 2 or more Medicaid managed care plans. Dupe SIN to be retained is the SIN under which the plan is entitled to retain the capitation payments and will continue to receive capitation payments. It is important that the correct SIN be entered in this field. Be mindful and don't reverse the SIN to be voided with the dupe SIN to be retained. The form date is the date the electronic form is submitted to OMIG and to the plan, notifying the plan of capitation payments that will be recouped. Please remember that the form must be submitted to both the plan and OMIG on the same day and must be submitted securely. The plans have 10 days from the form date to dispute the retroactive disenrollment. If the plan is not disputing the retroactive disenrollment, the plan must void the claim within 30 business days of the form date. Each record on the electronic form sent to the plan and OMIG must have the same form date. Please note that the form date should be the same as the date used in the original file name. Enter the date the change or event took place that resulted in the enrollee's termination of membership in the plan, for example, the date the enrollee died. The local districts requested that this column be added to the electronic form. This field is not mandatory. However, when the date of occurrence is available, it is helpful to the plans and OMIG. Use slashes when entering the date in the date of occurrence column. The date of occurrence column does not have to be filled in to enable the record to enter the database. This is an optional data entry. The following slides list the retroactive disenrollment codes. The retroactive disenrollment codes do not cover all the circumstances that lead to retroactive disenrollment. If you need guidance on which disenrollment code to use, send an email to retrodata@omig.ny.gov and OMAG staff will respond. The current retroactive disenrollment codes are 01 incarceration, 02 death, 03 permanent resident nursing home, 04 foster care, 05 long-term acute care hospital, 06 duplicate SINs same managed care plan, 07 third-party coverage or commercial health insurance, 08 low birth weight SSI newborn. As of April 1st, 2012, Disenrollment Code 08 is no longer a valid code. 09, non-consensual enrollment, which means that the Medicaid recipient was enrolled in a plan without their knowledge or consent. 10, break-in coverage. 12, Paris match, which indicates the recipient is receiving benefits in another state. 13, multiple SINs, different Medicaid managed care plans. Disenrollment Code 11, Other. Disenrollment Code 11, Other is no longer a valid code. The use of Disenrollment Code 11 will result in the record being rejected. Email retrodata@omig.ny.gov if you are uncertain which disenrollment code to use to submit a retroactive disenrollment notification. Medicaid Managed Care Plan Dispute Column and Dispute Process. The disputed column is exclusively for the plan's use. The plan enters an X in the disputed column if there is a disagreement regarding any aspect of the retroactive disenrollment notification. The plan should not alter data in any other column in the record. Simply enter an X in the disputed column. In other words, the plan does not enter data correcting the record in dispute. The plan sends the electronic form to the local district, New York State of Health, or Department of Health. Do not send a copy of the form to OMIG. All documentation supporting the dispute is submitted to the local district, New York State of Health, or Department of Health. The plan transmits the electronic form with the X to the local district. New York City plans transmit the electronic form with the X to Department of Health. For Medicaid recipients enrolled through New York State of Health, the plans transmit the electronic form with the X to New York State of Health. OMIG should not be notified of plan disputes. Disputes for reason codes 3, 4, 5, and 13. If a dispute for one of these codes is based on encounter data, the LDSS, HRA, or New York State of Health should not make a determination. Instead, instruct the plan to await OMIG audit for resolution of these disputes. This applies only to these specific codes, 3, 4, 5, and 13. These codes are subject to a new Department of Health OMIG encounter process, whereby plans may be reimbursed for services provided, dependent on OMIG audit determination. The encounters must be submitted to and successfully processed on the Medicaid data warehouse to qualify for reimbursement. The local district dispute process. Local districts resolve disputes with the plans for Medicaid recipients residing within their county and enrolled by the county. For Medicaid recipients enrolled by New York State of Health, the plan disputes are submitted to New York State of Health for resolution, not the local district. The local district makes the decision whether to accept the plan's dispute on the retroactive disenrollment notification. Local districts should resolve the dispute based on verifiable documentation, or information that can be confirmed by an independent third party. The local district should require verifiable documentation prior to making a dispute determination. Upon resolution, the local district or New York State of Health must submit a revision to the plan and OMIG. Submissions to OMIG should be transmitted using the HCS upload application. When local districts do not submit revisions to OMIG, the subsequent audit process is compromised. Please be sure to submit all revisions to OMIG. If the local district and plan cannot resolve the dispute documentation should be submitted to the Department of Health for resolution. If the resolution results in no changes to the original retroactive disenrollment notification, a revision with the K in the revision column must be submitted to OMIG and the plan. This will alert OMIG and the plan that the dispute has been resolved. Dispute documentation should not be submitted to OMIG. New York City dispute process. New York City Plan Dispute documentation for New York City residents may be transmitted to the Department of Health using secure email to jenniferlanglis@health.ny.gov or via HCS using secure file transfer to JLL05. New York City Plan Dispute documentation for Medicaid recipients enrolled by New York State of Health may be transmitted using secure email to edithwalbert@health.ny.gov or via HCS using secure file transfer to EMW07. Do not submit the dispute documentation to HRA or OMIG. Revision process. The revision column is used to respond to a plan's dispute. The revision column is also used to correct an error in a record previously submitted to OMIG and the plan. The local district, New York State of Health, or Department of Health enters one of the following: K, to keep the original record the same, M, to remove the record from the database, or V, to revise the record. The updated retroactive disenrollment notification is submitted to OMIG and the plan. The revision should not include the X in the dispute column. If an X is included in the dispute column with a revision, the record will be rejected from the database. When submitting a revision to a record, the original file name column must contain the same name as the very first electronic form submitted to OMIG and the plan. If there has been more than one revision to a record, each subsequent revision must contain the same form name as the first electronic form submitted. Do not use the file name used in a prior revision. Always refer back to the original retro. When submitting a revision, the original line number column must contain the same line number of the record from the first electronic form submitted to OMIG and the plan. If there has been more than one revision to a record, each subsequent revision must have the same line number of the record from the first electronic form submitted to OMIG and the plan. Again, place the appropriate letter in the revision column. K to keep the record the same. M to remove the record from the database. V to revise the record. Enter the original electronic form name in column original file name. And remember, the original file name is the very first retroactive disenrollment notification submitted to OMIG and the plan. Be sure to enter the original line number in column original line number. The original line number is the line number on the very first retroactive disenrollment notification submitted to OMIG and the plan. Enter the new form date, the date the electronic form is submitted to OMIG and the plan. Use the proper naming methodology for the electronic form name. For example, county code, Medicaid provider number, and date in the format month, day, year. Save a copy of the electronic form with the revisions. Send the electronic form with the revision to the plan and OMIG. Submissions to OMIG should be transmitted using the HCS upload application. And remember, do not put more than one plan's revisions on an electronic form, and be sure to submit all files securely to the plan. When multiple revisions are made to the same retroactive disenrollment, the original file name and original line number are entered on all subsequent revisions. Do not use the electronic form name and line number of the last revision. Next, we will review some common errors in retroactive disenrollment notification submission. If data is copied and pasted from other sources and entered on the electronic form, this may change the formatting, resulting in the form being rejected. If the electronic form is rejected, it will not enter the database. If formatting changes are made to the electronic form, for example, if data is centered, entered in bold font, the form will be rejected. If line numbers are missing or not consecutive, the form will be rejected. If the SIN is incomplete, missing, invalid, or in the wrong column, the form will be rejected. Always double check to ensure the SIN is correct. Repay premium from and repay premium to dates are missing, incomplete, or reversed. If the revision code K, M, or V is missing on a revision, or if the original file name and/or original line number is missing on a revision. If the form date is missing, incorrect, or different form dates are entered on one electronic form, the form will be rejected. If the duplicate SIN to be retained is missing on the electronic form when using Disenrollment Code 06 or Disenrollment Code 13, the form will be rejected. Do not reverse the SIN to be voided with the SIN to be retained in circumstances of Code 6 or Disenrollment Code 13. Be sure the same SIN is not entered in both columns. We will now go over a few final reminders. Retroactive disenrollment notifications submitted by the local district, HRA, or New York State of Health to OMIG are not forwarded to the plan. All retroactive disenrollment notifications and revisions must be sent to both OMIG and the plan on the same date. Please note, the HCS upload application only submits the forms to OMIG. The plan must be notified by the district in a separate secure transmission. Submit only one electronic form for each plan to OMIG per day. If more than one electronic form for a plan is submitted, the entire electronic form will be rejected. This item is extremely important. If a retroactive disenrollment notification has been overlooked, save the disenrollment for the next day. Submit all revisions to OMIG using the HCS upload application. Press the Tab key on your keyboard after each data entry to enter the next field. This prevents filling a field with inappropriate data, such as the Plan ID column with data for SIN to be voided. Often when entering data, an individual will inadvertently enter the data in the incorrect field. For example, on this slide, the Plan ID and SIN to be voided appear to be in the correct columns, but if the Plan ID column is expanded, you see that the SIN entered is actually in the Plan ID column, and the SIN to be voided column has no data. Be sure to use the correct format for the electronic form name. The first 2 numbers are the 2-digit county code. The next 8 numbers are the plan's Medicaid provider number. And the last 6 numbers are the date in the format month, day, year. Enter the original electronic form name and original line number on the electronic form when submitting a revision for a prior retroactive disenrollment notification. Do not enter data in the original file name field or the original line number field if the electronic form is not a revision. Do not reverse SIN to be voided with the dupe SIN to be retained. Remember, the SIN to be voided column is the SIN for which the capitation payments must be recovered. The dupe SIN to be retained column is the SIN under which the plan will retain the capitation payments. Do not enter the same SIN in both columns. Do not enter disenrollment code descriptions in the disenrollment code column. Do not copy and paste data from another source. The data format may be different. When a SIN has a break in the repay premium from and repay premium to columns, use separate rows for each interval and fill in the data completely on each row. Never change the formatting on the electronic form. The form is pre-formatted to enable the data to enter the database. Examples of formatting changes include the following: centering the data in the field, using bold, italics, or underlining, changing the font, adding additional spaces in the data fields, hiding, moving, or adding columns or rows. There appears to be some confusion related to disenrollment of Medicaid recipients with commercial health insurance or Medicare. The following 2 slides offer some guidance. Commercial third-party health insurance does not have to be identical to the Medicaid coverage for a retroactive disenrollment to be made. For a retroactive disenrollment to be made, third-party health insurance should be comprehensive and provided through the same managed care organization as the Medicaid coverage. If third-party health insurance is provided through a different managed care organization, the disenrollment must be prospective. If you are unsure if third-party health insurance is provided by the same managed care organization, contact OMIG at retrodata@omig.ny.gov. Once a Medicaid recipient is determined to have Medicare coverage, the recipient is subject to disenrollment from the plan. Medicaid recipients in receipt of Medicare are prospectively disenrolled from mainstream managed care plans. Only enrollees 65 and older who are not receiving Medicare may remain in the mainstream managed care plan. The following slide lists contact information. Send questions on the retroactive disenrollment process to the following email: retrodata@omig.ny.gov. Thank you for your attention to this webinar.